Hello, everyone. My name is Robert. I am a nursing student from Nightingale College. Today, I'm going to be performing a video skill, which is the Neurovascular Assessment. Um, I am here with the patient. Let me just go ahead and kind of speed ahead. I went to the patient's room. I knocked on the door. I introduced myself to the patient. I explained to the patient why I'm here. Also, I provided privacy and performed the hand hygiene. I'm wearing my school uniform and badge. Now, uh, First things first, since I already did the hand hygiene, I'm going to go ahead and identify the patient. Ma'am, can you please tell me your name and your birthday, please?
K. Johnson, June 2nd, 1980.
Okay, so for Kay Johnson, as I said to you before, we're going to be doing a neurovascular assessment. And what this assessment is for is to check out or to assess your sensory and your motor skills. But do I have your consent to conduct this assessment on camera?
Yes, you do.
Okay, yes, I have the patient's consent to conduct this on camera. So, first things first, we are going to be doing, first part of this assessment, we're going to be doing the sensory response to superficial touch and pain. So the items I have here, I have a Q-tip and I have a pin tool, and on the other side of the pin tool, I have a dull sensation or a dull portion of the pin tool. Okay, so ma'am, I'm going to have you put your arms out. And I'm sorry, put your arms out just you can rest it right there. And just let you know, part of this assessment, I at times I'm going to actually have to maybe touch your arms or touch parts of your body. I'm going to have you close your eyes at times. I'm going to be touching with different items. I'm going to be doing a reflex check of your tendons and everything, using a reflex hammer. And also, I may even have you close your eyes at times and have you stand. Is that okay?
Yes.
Okay, I also got that part consent for that as well. But back to the sensory response, I'm going to go ahead and have you close your eyes. And I want you to tell me if what I'm touching. So what I have here is, as I said, I have a soft Q-tip, a sharp tool, and something dull. So right now, you let me know if what I'm touching with, is it sharp, dull, or is it soft? Okay?
Okay. That would be soft.
Okay, that's soft.
Sharp.
Sharp, okay. And,
Dull.
okay, that's dull.
Sharp.
Sharp, okay.
Soft.
Soft, okay. So that part is good. I'll go ahead and document my findings on that. Now we're going to go ahead and check the patient's perception of position and movement. So what I'm going to do is have the patients go ahead and you can open your eyes for now, and then I'm going to have you put your hands up. Put your hands up and your feet out. Just your feet out. No, you can put it right about there. And what I'm going to do is I'm going to be moving either your fingers or your toes, either up or down, and you tell me if it's going to be going up or down. Okay? All right, close your eyes, please.
Up. Down.
Okay.
Up. Down.
Okay.
Down. Up.
Okay.
Up. Down.
Okay, thank you very much. You can open your eyes now. Put your hands down. Okay, now what I'm going to be doing is I'm going to be checking the patient's ability to identify familiar objects. I'm going to have the patient close their eyes and put your hand out. You can use both hands or with your palms up. Okay, I'm going to put an item in your hand, and you can use both hands to determine what that item is, okay?
Okay.
Okay. All right. With your hand, let me know what that is.
Coin.
Okay, that is a coin. That is correct. I'll go ahead and document my findings there. Okay, now you can go ahead and put your hands step back to normal. You go ahead and rest your hands. And what I'm going to be doing is called a 2-point discrimination. I'm going to be using a paper clip. With this paper clip, I'm going to be touching your skin with either one point of the paper clip. The paper clip is open, by the way. It's an open paper clip. Open paper clip. I'm going to be touching your skin with either one point of the paper clip or 2 points, right? You let me know if 1 point is touching you or 2 points is touching you, okay?
Okay.
All right. So here we go.
1.
Okay.
2.
Okay.
1.
Okay.
1.
Good. Okay. So with that, I'll go ahead and document the measurements and record those numbers, right? So I'm going to go there and put that there. Now from there, I'm going to go ahead and assess the patient's ability to identify a number or a letter that I'm going to draw in the palm of her hand. I'm going to use the end of this because this is very smooth, right? So if you can put your palm up, just up like a high five. Put your hand up like a high five. Okay, close your eyes, please. Okay, let me know if it's what am I drawing in your hand? Either it's going to be a number or an alphabet. Okay, here we go.
2.
Okay, the number 2. Patient is able to identify that. I'll go ahead and document that findings. Now, what I'm going to do is I'm going to have the patient identify the part of her body that I touch. You could just verbalize it. Like, for example, you could say left knee, right elbow, left shoulder, right shoulder, right? Chin. All right, so I'm going to have you close your eyes. And I'm going to touch different parts of your body.
Right shoulder.
Okay.
Left hand.
Okay.
Left knee.
Okay.
Right knee.
Okay.
Left shoulder.
Left shoulder. Okay. Patient is able to identify that. Now we're going to do the superficial deep tendon reflex, starting with the bicep. So what I'm going to do now, I'm going to be using my reflex hammer. And with this reflex hammer, I'm going to be using the more pointed end of this. I'm going to have the patient, I'm just going to have you take your arm. I'm going to have you rest your arm with your palms up. And I'm going to find your bicep tendon, right? And I'm just going to check here for your bicep tendon, okay? The reflex. Okay, I will give that a 2+ response, which is a expected response. That is a normal expected response. Then from there, we're going to be using the flat end of the reflex hammer, and we're going to be checking your patella. Go ahead and relax your knees here. All right, we're going to come down, and okay, good. And we're going to check one more time. Okay, good. All right, so we'll go ahead and document that. And now, for there, we're going to also check the patient's plantar reflex. So from here with the plantar reflex, the key is to, we're going to be using this part or the sharper end of the reflex tool. It's not too sharp. It's not going to be dangerous. But what I'm going to be doing now is we're coming up the lateral side of the patient's foot, right? We're going to come up the lateral sides, and we're going to be, lateral sides is like we're going to draw an upside down J. So it's going to go up the lateral side into the medial ball area of the foot. So what I'm going to do is this. We're just going to go up the lateral sides. Okay. One more time. Let's do that again. Okay. This is a good response. It's a natural response. If the toes either have a no response, that's good. Or if it goes down, curl down, that is a good response. It is an abnormal response if the toes flare up, right? Toes flare up, right? So I'm going to go ahead and document the findings there on that one there. And now I'm going to check the patient's ankle clonus, right? So from there, what I'm doing here, I'm going to have the patient relax her foot here. And what I'm going to do is I'm going to dorsal flex. I'm going to dorsal flex a few times and then check the response. What I'm looking for is if it just if it relaxes, then that's good. So I'm just going to dorsal flex and then release. Now if her foot shakes or even quiver, if I feel any form of quivering or shaking, then that will be an abnormal response. Then of course I would have to go and document that. On some of these skills I should have mentioned, I'm just doing, I'm going to do some of them bilateral. Other skills I'm going to be doing is going to be just on one side, because for the sake of the time and on the camera, we don't want it to last like a 30-minute video. Now we're going to be doing a cerebral and functioning I can't even say the word. It's going to be a cerebral function and proprioception. So we're going to have the patient put your hands. We're going to have the patient put their hands out, hands all the way out, and you're going to close your eyes. Okay, you're going to touch your finger to your nose, left hand, and then back out. Finger to your nose, right hand, and then back out. You're going to do that back and forth a few times quickly. One, good, good. She's doing it, good. And good, and relax. Good, thank you very much. You can put your hands back down. Okay, so now we're going to check the patient's coordination and her motor skills. We're going to have her put your palms down, and you're going to bring your palms up and down real fast. Okay, good coordination. All right, good, and good speed as well. So then from there, we're going to do the same thing with your feet. Go ahead and dangle your feet and lift your feet up a little, and you're going to be doing the same thing with your feet. Only try to just move your feet up and down. Just your feet. Now move your feet, all your feet just like that, right? And now stop. Now feet up and down. Okay, feet down. Okay, down, all the way down. You can relax your feet now. You can put your feet down. Okay, now from there, I'm gonna have the patient stand for a moment. Then I'm gonna have you just run in place. Wait, I'm sorry. I'm gonna have you run in place. Go ahead and run in place. Okay, good. Thank you very much. You can sit back down. Okay, now from there, I'll go ahead and document my findings. And I shouldn't have had her sit back down yet. So now, what we're going to do now is we're going to be checking the patient's balance with the Rumborg test. And what this is, we're going to have the patient stand with their eyes closed. I'm going to be timing it. We're going to do it for at least 1 minute, right? And after we do that for 1 minute, well, of course, I'm going to just move this chair, make sure that she doesn't fall. Get balance. I'm going to have you put your hands at your side, please. Oh, no, at your side, just at your side, regular. Okay, close your eyes, and I'm going to be timing it for 1 minute. Okay, timing it for 1 minute. I'm just making sure she doesn't fall. I'm bracing. Okay, here. Let's see. Okay, let's see the timer. All right, good. There's my timer. Yep, just stand still. I'm just checking and evaluating the patient's, making sure that doesn't stop. Okay, good. Evaluating the patient's posture. And let's put my code back in there. Good. Okay. Okay, she's keeping her balance, which is good. Okay. And okay, all done. All right, and then from there, I'm gonna observe the patient posture. I'm gonna have you walk from this side right here, come all the way this way, all the way to your, okay, good, stop, turn around, go back. Okay, good. Here's a chair here, you can grab a seat. Now from there, I would document the patient's gait. I'll document the sway of her feet, of her hips, making sure her trunk isn't swaying. She does have good posture, good gait. Her feet are actually coming off the ground, and her feet are passing past each other. And yeah, I'll go from there, and I'll document the rest of my findings. Thank you, ma'am, for participating, and you have a good day. So then I'll go ahead and document everything, and that's it. Thank you.